of serious long-term disability in the United States. As part of Stroke Awareness Month in May, Encompass Health is partnering with the American Heart Association to educate communities that stroke is largely preventable and treatable. Encompass Health Rehabilitation Hospital CEO Marcus Braz and Manatee Health Stroke Director Dr. Ralph Gonzalez are here to tell us more. Welcome to both of you. Such an important topic for everybody, but let's start with the definition. What happens inside our bodies when we have a stroke?
Well, when someone has the most common type of stroke, which is an ischemic stroke, that means the blood vessels that supply an area of the brain become blocked for various reasons, a clot or something wrong with the blood vessel itself, causing an area of the brain that is supplied by that artery to be starved of oxygen and glucose and basically to die.
And that can happen in a very short amount of time, the brain issue, correct?
Exactly. The brain will start having symptoms or dysfunction after only a few minutes without having blood. And that's where the definition of stroke, because it happens out of the blue. It strikes a person down. There's often no warning, it just happens.
Oh, okay. So the protocol for stroke treatment, as we look past the initial event and then how to recover, is changing. New guidelines are being issued. So tell us about those guidelines.
Certainly. For the first time, the American Stroke Association has issued guidelines of where stroke rehabilitation should take place. And those guidelines indicate that it should take place in an inpatient rehabilitation facility, such as Encompass Health of Sarasota, where the patient will be able to receive intensive rehabilitation services, such as physical therapy, occupational therapy, and speech-language pathology.
What was happening before now? Were people being released from the hospital and then kind of on their own for rehabilitation?
Multiple things are happening, but people would be going home in some cases, not getting the intensive rehabilitation, or they'd be going to a nursing home or a skilled nursing facility where the requirements of that intensive therapy service is not a regulatory requirement, where it is in an inpatient rehab facility.
Well, it's great that we're finding ways to make the recovery a little bit better, but let's get back to that initial event, because I know it alarms everybody when you say it just happens. That's kind of all of our greatest fears when things just happen. When something does just happen, initial diagnosis, initial treatment, this is all changing as well. Tell us about that.
It's changed a lot in the last, particularly the last 5 years. Stroke's been evolving over the last 20 years since the advent of a clot-busting drug called Alteplase, and it was approved in 1996. But since then, things have gradually evolved until 2015, when things changed exponentially with the publishing of a lot of protocols that showed that mechanical thrombectomy, or mechanical removal of a large clot, helped exponentially over just Activase alone. Okay, so that really changed the game when it comes to stroke care. So the main thing that people need to do when it comes to stroke is call EMS and get to the nearest emergency room that is a stroke center. When you call EMS in most counties in the state of Florida have protocols to take you to the most appropriate stroke center. So that's the biggest thing that people need to do, is call 911 and get to a stroke center.
Well, and some of the newer protocols you mentioned in the last few years say that, yes, even though those first few minutes can cause damage, it's still worthy to continue to get in and make a solution even after those first few minutes have passed. Explain that a little bit.
Absolutely. Initially, when all we had was Alteplase, or the clot-busting drug, we had a very finite amount of time. We had 3 hours, and in some cases up to 4.5 hours to do something. Now, with the advent of mechanical thrombectomy and other studies that have shown that mechanical thrombectomy can be helpful in up to 24 hours in certain cases, that opens the window hugely for people who may have gone to sleep fine and woken up with symptoms. Before, when you woke up with symptoms, you were almost always outside of the window for IV lytic therapy.
Right.
Because you were typically asleep for more than 3 or 4 hours.
So still a scary concept, but a little bit more room in being able to solve, the problems that result. Some of this is also recognizing the symptoms, and we've heard this for years and years and years. You have a new acronym that you want people to remember on how to recognize stroke symptoms. Let's talk about Be Fast.
Okay, Be Fast is the current acronym for people to recognize the potential signs and symptoms of stroke. Okay, so B stands for balance, E stands for eyes or vision, if you have problems with your vision, F is for face, so if you have drooping or numbness on one side of your face, arms, any weakness or numbness in your arms, and speech, slurred speech, or the inability to speak. Okay, and then T obviously is time, which is time is of the essence. That's where we say call 911. If you have any concern that you're having a stroke, call 911 and they'll get you to the nearest appropriate stroke center.
Any one of these symptoms, I would assume in this case, better safe to check since time is critical.
Absolutely. We, as neurologists, we would much rather have you in the emergency room not having a stroke than at home having a stroke where we can't really do anything for you.
Okay, good to recommend, and certainly great that Encompass Health is here helping educate us about all of these different things. Now, you can register for a free stroke awareness event. It is coming up on Wednesday, May 22nd, and to do that, you'll want to visit encompasshealth.com/Sarasota Rehab. Coming up next.